Hey guys, today I'm going to talk about celiac disease. Everything you need to know about celiac disease is in this video, so let's get started. Celiac disease is an autoimmune disorder that's triggered when you eat gluten. It's also known as celiac sprue, non-tropical sprue, and gluten-sensitive enteropathy. So what is gluten? Gluten is a protein that's present in a lot of different grains, like wheat, rye, and barley. It's what makes the dough elastic and gives the bread its chewy texture. When someone with celiac disease eats gluten, its immune system is triggered and it starts attacking the small intestine along with this protein. So the immune system hates this protein basically. It becomes so angry when it sees this protein, and so it activates and starts attacking the small intestine, especially a part of the intestine that is called villi. Villi are small projections in the small intestine that helps with the absorption of stuff. Basically, the function of small intestine is non-existent if you do not have villi. If your celiac disease isn't any better after 1 year without gluten, it is called refractory or non-responsive celiac disease. Most people with celiac disease don't even know that they have the disease because it takes up to 10 years for the complete damage to the villi to occur with people with celiac disease. Researchers think that about 20% of people with celiac disease actually know their diagnosis. Celiac disease is not the same as gluten intolerance or gluten sensitivity. People with gluten intolerance may have some similar symptoms, but they do not have the damage to the villi that people with celiac disease have. Another important distinction is allergy. Celiac disease is not food allergy. It's completely two different pathways, two different pathophysiological pathways. Food allergy is type 1 hypersensitivity reaction. Celiac disease is type 4 hypersensitivity reaction. Complete different sets of cells attack and cause the problems. Completely two different sets of cells are involved in food allergy versus celiac disease. So people with celiac disease may have abdominal problems because of the damage that happens to the small intestines. So they may have abdominal pain, diarrhea, fat in the stool, steatorrhea, bloating, or things that are associated with malabsorption because they don't have enough vitamins and nutrients. They may have anemia, joint pain, bone pain, headaches, fatigue, even mouth ulcers. Mouth ulcers are very common with people with autoimmune diseases in general. An important symptoms in people with celiac disease is loss of bone density and hyposplenism. And this is because of the loss of nutrients in the stools that results from damage, severe damage to the villi of the small intestine. In children, because the villi are not absorbing enough nutrients, children may have a lot of different symptoms that are associated with nutrient deficiencies, like anemia, because they don't absorb B12 or iron very well. They may have damaged tooth enamel, delayed puberty, failure to thrive, neurological problems, and even slow growth and short height. All that from the nutrient deficiency, because your small intestine is not absorbing anything right now. Another very important symptom is rash. It's a very, very characteristic rash that occurs on the extensive parts of the legs. It's called dermatitis herpetiformis. It's very similar to the herpes vesicles, the vesicles that appear from herpes infection. But this is not because of herpes, this is because of celiac disease, especially because of the accumulation of antibodies in the skin of people with celiac disease. So what is the cause? What is the etiology behind celiac disease? What are the risk factors that increases the likelihood of a person to get celiac disease? Research hasn't found a definitive cause for celiac disease. It tends to run in families and might be linked to certain genetics. Stressful medical events such as viral infection or surgery can trigger it. So can emotional trauma or pregnancy. If one of your family members, like a sibling or a parent, have celiac disease, you have about 1 in 10 chance of getting celiac disease yourself. Celiac disease is common in people with a lot of other autoimmune disorders. So autoimmune disorders tend to come all together. So people with specific autoimmune disorders are at more risk of getting other autoimmune disorders. So people, for example, with Hashimoto thyroiditis, in which the immune system attacks the thyroid gland, have a very high chance of getting celiac disease as well. What about the complication? What could happen to somebody with celiac disease? Complications like cancer, like intestinal lymphoma or small bowel cancer, damaged tooth enamel, infertility or miscarriage, lactose intolerance even. So how do I know if I have celiac disease? How do doctors diagnose celiac? Doctors use blood tests and other tests to help find out if you have celiac disease. What is the treatment and the diet of patients with celiac disease? Patients with celiac disease have to take very good care of what they eat. They have to make sure that they do not get gluten in anything they eat. There are no drugs to treat celiac disease. It's something that's inherent in patients with celiac disease. Their immune system is structured in a way that it reacts very badly with gluten, anything that has gluten in it. So the only treatment here is to avoid gluten. Anything that has gluten has to be avoided by patient with celiac. So what are things that have gluten inside of them? Beer, bread, baked stuff like cakes, cereals, pasta or noodles, crackers, pancakes, gravies. Any of these could potentially have gluten. If it's not 100% gluten-free, you should not eat them. Otherwise, you will get the autoimmune system activated and the immune system will attack your small intestine and result in malabsorption and the stuff we talked about in this video. Even some medications have gluten inside them. Some toothpastes have. So you have to make sure everything you're using, even medications like I said, you have to make sure that they do not have gluten inside of them by checking the labels. Check the labels, check the labels, check the labels. Patients with celiac disease, check the labels. When you have gluten-free diet for a couple of weeks, your small intestine will start to heal and your immune system will tone down so that it does not attack your small intestine. It does not attack you. It will stop attacking you, right? Because you don't have the gluten that stimulates and makes the immune system angry and all that. So you have to take very good care of what you eat, my friend. And here we come to the end of the video. I hope you enjoyed it. I hope you liked the information. And please, if you like this video, please smash the like button and subscribe because it helps a lot with the algorithm. And if you have any comments, please let me know. And any questions, I will be answering them as well. Thanks so much for watching and see you in the next video. Bye.